Hello, and welcome to another Supporting Client Health and Wellness class presented by the Far Northern Regional Center's clinical team. Today, we're going to be finishing up our Fatal 5 series on the top 5 causes of death for people with intellectual and developmental disabilities. We're going to talk about dehydration. Why dehydration is so important, what the effects of dehydration are, conditions that put some people at risk for dehydration, symptoms to watch for and what to do if someone is dehydrated, as well as prevention measures that can be implemented right now. So did you know that the human body is made up of 60% water? You can see here that our most important organs, the brain, heart, liver, and kidneys, are all 75% or more water. These organs are what keep us going, and their functioning is necessary for us to be healthy and alive. And hydration is very important to keep them working properly. But why do we need to drink fluids? Can't our bodies just hold on to the water it has to be able to function? The reality is we are constantly losing water. There are 2 types of water lost from the body: insensible and sensible. It's hard to imagine, but we lose up to 30 ounces a day just from breathing and moisture lost through our skin that we don't even feel. And depending on urine output, or if we were having like diarrhea or vomiting or excessive bleeding, we can lose another 60 ounces or more. So there's a constant need to get fluids into our bodies to replace the water lost just through normal living and bodily functions. Water is used by the body to keep our kidneys filtering our blood and producing urine. Water keeps food and fluids moving through the GI tract and actually increases the absorption of nutrients. It keeps the brain working properly and lubricates our joints so we can move easily and without discomfort. Hydration helps us maintain a normal body temperature around 98.6. It makes up a high percentage of our blood and keeps blood cells moving through the circulatory system so they can deliver oxygen to our cells and take away carbon dioxide. And we can't produce our own body fluids without water. Fluids such as blood plasma, lymphatic fluid, respiratory secretions, bile, stomach acid, etc. These are all made with water. So what is dehydration? Dehydration is having insufficient body water and fluids needed to carry out normal functions. And it occurs when a person is not taking in enough fluids or loses more fluid than they take in. If you look around online, many resources say that 75% of Americans are chronically dehydrated because we simply do not drink enough water to compensate for the water that we lose. Dehydration may be mild, moderate, or severe. And while mild dehydration often has symptoms that are overlooked or ignored, severe dehydration can lead to serious complications and can even be fatal. So let's look at a few of these possible complications. First, we'll talk about kidney function. Extreme dehydration for an extended period of time can cause severe damage to the kidneys. Your kidneys are responsible for filtering out waste from the blood via urine. In addition, the kidneys help manage the balance of electrolytes and salts in the blood. When the renal system is compromised or shuts down, Toxins begin to build up in the blood. Electrolytes and fluid also build up in the body, causing swelling. Severe renal failure or kidney failure results in severe illness or death. The next one is digestion. Hydration is a key component to keeping your internal pipes flowing properly and regularly. Dehydration often results in constipation, in addition to gastritis, acid reflux, and in some cases, ulcers. Drinking water helps produce digestive acid that in turn helps your body break down food. When your body doesn't get enough water, it's unable to absorb the proper amount of nutrients from the food that you're eating. And the brain. Our brains are made up of 75% water. When we become dehydrated, even the tiniest bit, our brain has difficulty functioning, often leaving us confused and forgetful. Furthermore, prolonged dehydration in older adults causes brain cells to actually shrink. And this has been linked to a symptom of the onset of dementia and Alzheimer's. And you can see in this picture the vast difference between the well-hydrated brain and the dehydrated. This brain here is just kind of shriveled and pruned, right? And so things are not functioning normally like they would in somebody who is hydrated. Dehydration can occur from diarrhea or vomiting, really profuse sweating, prolonged high fevers, or certain medications and chronic illnesses. Also, if you don't drink enough when you're sick, you can get very dehydrated. Severe acute diarrhea can cause a tremendous loss of water and electrolytes. Vomiting is even worse, and fever can make it even worse on top of that. You lose water when you sweat. You need to drink fluids when exercising or working outside or when exposed to prolonged heat. Hot weather increases the amount you sweat and the amount of fluid you lose. For chronic illnesses, things like diabetes that is uncontrolled or untreated can cause increased urination, which can lead to dehydration. Kidney and heart disease those folks might take medications that increase the risk of dehydration, such as diuretics, and some blood pressure medicines as well. Even some antipsychotics, antihistamines, laxatives, or lithium can lead to dehydration. Constipation may not feel like eating or drinking very much when you're constipated, but that worsens your constipation and dehydration. When you're ill, it makes you less likely to feel like eating or drinking. Also, if you have large wounds or burns, that can contribute to fluid loss. These conditions can happen to any of us, so it's important to be aware of the risk to you and me, but some people have an increased or higher risk of getting dehydrated. So who are those people at an increased risk? So first, we're going to talk about older adults. Older adults develop an impaired response to thirst, so they don't always feel the need to drink when they should. Then infants and children who can easily become dehydrated and tend to show signs of dehydration more readily. Also, people using support from others for their liquid needs can be at a particular risk if fluids are not offered at regular intervals throughout the day. Individuals with intellectual disability and/or developmental disability may not be able to comprehend the importance of hydration and act on that comprehension by mindfully ensuring that they're drinking enough. They may not be able to recognize or explain when they're thirsty, and they may not be able to get a drink for themselves. Individuals with intellectual disability may make poor beverage choices like energy drinks and soda, which actually make dehydration worse, not better. Thirst isn't always a reliable indicator. Many people don't feel thirsty until they're already dehydrated. By the time a person experiences thirst, they may have lost 2 to 3% of their body weight in fluids. That's why it's so important to increase fluid intake in hot weather or when someone is sick, because they may not be thirsty. It's not a reliable sign of the need for water in the IDDD population. A better indicator of proper hydration is clear or light-colored urine, which we'll talk about more a little later. Sorry, I guess I should have gone to that side. So yes, so if somebody has communication challenges, they're going to be at a greater risk. They may have difficulty communicating or be nonverbal. They can't ask for a drink when they're thirsty or tell you when they need to come out of the sun or if they're feeling overheated. They also can't self-report signs of dehydration like dark urine or their mouth is dry. So what you might see in individuals who have difficulty communicating, kind of like this guy in the picture, right, is that, it may be more of a behavioral sign that you're seeing, and that they're just irritable or tired or not doing well, but they may still not be able to specify with you that it's the fact that they are thirsty is the problem. Mobility issues can also prevent access to fluids. They might not be able to move out of the sun to cool off if they're starting to sweat. They may have decreased upper body strength that makes it difficult or impossible to grab a cup and drink from it. Individuals with tremors can cause spills and frustration, which might lead them to put off drinking altogether. Decreased coordination can cause people to not be able to get a glass up to their mouth for drinking. They may spill more fluid than they actually consume. These individuals may only get the fluids they drink when someone is holding their cup for them and putting it to their mouth. And so that means that they are entirely dependent on how often the drink is being offered to them. So if staff is busy and they're doing other things and they're not, following a timeline for offering drinks, the staff may not even realize that that they're actually contributing to the person becoming dehydrated, because that person relies entirely on their staff to get a drink. Oral motor dysfunction or poor oral health can cause a person to avoid eating or drinking. They may have pain when chewing or swallowing, so they avoid eating and drinking. They may have sensitivity to cold or hot fluids as well. Or when they drink, they aren't able to get all the fluids into their body. This is also a choking risk. And individuals with dysphagia or trouble swallowing, they may refuse to eat or drink if they know they're going to cough or could choke. Maybe if liquids are thickened, it can increase their fluid intake, or maybe they could benefit from a special type of cup. Adults actually produce 1 to 1.5 liters of saliva every day, but we swallow it and we reabsorb it into our bodies. However, people who have constant drooling are losing all of that fluid, and they need to maintain adequate water intake throughout the day to compensate for that loss. You might know clients who have trouble with drooling, so that is something to think about, that they're actually losing fluid from their body whenever they're drooling like that. So the symptoms of dehydration. We can go through this list here. Thirst, right, which we already know is not super reliable. You're pretty dehydrated by the time you're feeling really thirsty. Oftentimes having a dry, sticky mouth or chapped lips. Sometimes bad breath can occur if someone's dehydrated. Their tongue may have fissures or be brown in color. They might get a headache or some dizziness. That effect on the brain of not having enough fluid can cause mood changes or unclear thinking. They may feel really tired. They might be weak. They could even end up with some cramping. They would also have decreased urination, or the urine that they had coming out would be very dark in color. They can also be constipated or even have an impaction. And their skin elasticity would be decreased. They can also have even a measurable weight loss. So why so many varied symptoms? Well, because most of the body's systems and functions are affected by dehydration. And so it really does affect everything. Here are the signs of severe dehydration: sunken eyes, sunken cheeks, lack of sweat, having low blood pressure and a high heart rate. Dehydration can cause confusion and weakness. It can lead to medication toxicity because there's not enough fluid to the amount of medication that's in the blood. And so the concentration is higher, causing toxicity and whatever those toxic effects are of the meds that they're on. Severe dehydration can also lead to seizures and, in extreme cases, coma and even death. So close monitoring is key. It's important to keep a record of what signs and symptoms you observe and actions you've taken to address your concerns. Report any concerns to a known contact. You should always know who to report to. And document intake and output. Pay close attention to urine output. Is it dark? Is it concentrated? Are they urinating less frequently? For individuals who are incontinent and using briefs, this is actually a little easier to monitor because care staff are directly involved with helping to change the client and will hopefully notice if they've been dry a really long time. But for clients who toilet independently, you may need to rely on them to report to you about their urine. Staff can monitor how often they use the restroom and ask the client about urine color. So to this point, it's important to teach clients to recognize when their urine is dark and ask them to let you know if it is. This is a graphic that I pulled off the internet, and there's a lot of them out there. It's really easy to print something like this up use it as a teaching tool and tape it to the wall in the bathroom as a reminder to the client to let you know if their pee is in the darker range. Or if you're monitoring someone who's at risk or who you think is dehydrated, ask them to let you see it before they flush the toilet. So how do we respond to signs and symptoms of dehydration? Most mild dehydration can be treated just by drinking fluids. You want to rehydrate gradually. So, taking small drinks over time, not just chugging a huge amount of water all at once. Adults should rehydrate with 12 8-ounce glasses of water per day if they're already dehydrated. Under certain circumstances, rehydrating too rapidly may result in water intoxication. So that's why you don't want to just like chug a whole bunch of water, because that's not good either. Water intoxication causes hyponatremia or low sodium levels. So you just need to take it slow. If someone is on a fluid restriction, reach out to their primary care provider for guidance. And for moderate dehydration, you may need to take that individual to the emergency room to receive IV fluids. Interventions may include ordering lab work to determine if they are dehydrated or to determine effects on the body, such as medication levels. Call the doctor if the fever that doesn't get better with fever medications like acetaminophen or ibuprofen. If someone is vomiting repeatedly and they're unable to keep fluids down. Anytime there's blood in the vomit, which would either be bright red or look kind of like coffee grounds, you would want to definitely get a hold of the doctor or go to the ER. If they're having diarrhea more than 5 times in a day, or if there's mucus or blood in the diarrhea, definitely give the doctor a call. If someone has abdominal distension or they have increasing abdominal pain, increased irritability, a decrease in urine or a lack of urine altogether, if they have increased dizziness or lightheadedness or sleepiness or just a general decreased level of activity, then we want to definitely reach out to a physician or go to urgent care or the ER and be seen for any of these things, okay? All right, and then there's emergency situations. So anytime the heart rate is greater than 120 at rest, especially if also short of breath or feeling faint, that would be an emergency. If someone becomes very confused or has changes in their mental status, that is an emergency. If they have some very unusual behavior for them, they're just acting totally out of sorts, then we definitely want to get them seen. Also, if they have difficulty walking that they haven't had before, that came on very suddenly, you would want to take them to the ER. If their skin is extremely hot or cold, or their core body temperature, when you take their temperature, is very high or very low. Any fainting, sudden dizziness, or sudden weakness, new or uncontrolled seizures, persistent or severe vomiting or diarrhea, or anytime, of course, that someone is unresponsive or unconscious, we want to call 911 right away. If someone, I want to add just a little note to the end of this one. So if somebody is unresponsive or unconscious, it's really important that staff immediately call 911. And I just want to say that you shouldn't be reaching out to like your manager first to ask what to do. Okay. If someone is unresponsive, unconscious, or having uncontrolled seizures, those are medical emergencies that need to be dealt with immediately. Okay, call 911. It takes them like 10, 15 minutes to get there. So get them coming before you reach out to admin to let them know about the situation. Okay, please do not postpone getting emergency care so that you can call someone and get permission to call 911. Okay, you don't need permission to call. If there's an emergency, please just do so. So there are some complications that can occur when dehydration goes untreated. And the most common one we see is urinary tract infections. Also, kidney stones can form when someone is dehydrated. They don't have enough fluid, but they still have all of the calcium and salts and minerals in their blood that's being filtered. And so when there's not enough water to flush those things down into the bladder to be urinated out, they can collect within the kidney and form kidney stones. In bad situations, you could actually end up with kidney failure. Electrolyte imbalance occurs, and this can lead to involuntary muscle contractions or loss of consciousness. They can also have a heat injury, which the symptoms might be like really severe cramps, exhaustion, or even a stroke. Also, hypovolemic shock from low blood volume. So that will lead to low blood pressure, not enough oxygen to vital organs, and possibly coma or death. So these are all things we want to avoid, right? So let's talk a little bit about prevention, because the best thing you can do is prevent dehydration in the first place. So how do we do that? We have to drink enough fluids. The general guideline is 1/2 ounce of fluid per pound of body weight daily. So in other words, let's say I weigh 150 pounds, a 1/2 ounce or half of 150 would be 75. So 75 ounces per day, or about 4.5 16-ounce bottles of water is what I should be drinking. And it sounds like a lot, but honestly, if you spread that out over the course of the day, it's really not that much. You can also increase your fluid intake by eating plenty of fruits and vegetables that are high in water content. And drink water if you're feeling hungry, drink during and in between meals, and drink fluids before, during, and after exercise. We want to be sure to increase fluids when out in the sun or in the heat. Remember, it gets over 100 degrees in the shade here. And if the AC goes out, you want to make sure to increase everyone's fluids, because everybody is going to need extra fluids if it's really hot in the home or in at your program. Also, if somebody's sweat is a sweater, they just sweat a lot, or maybe they sweat a lot at night. If they wake up and the sheets are wet and their pajamas are wet from sweating, that give them a glass of water because they need to rehydrate, okay? And also avoid caffeinated beverages. So coffee, tea, soda, energy drinks, anything with caffeine in it is going to actually make dehydration worse. We'll talk a little bit more about that on the next slide. Drinks to avoid. So drinks that are high in sugar should be avoided as they actually make dehydration worse. Sports drinks should only be used with intense exercise. They replace electrolytes lost through sweating, and they give sugar needed for energy, but the high sugar content can actually lead to more urination and water loss. Energy drinks are not formulated to replace electrolytes. They contain large amounts of caffeine, stimulants, sugar, and other additives that contribute to dehydration more than help to resolve it. Again, caffeinated soda, coffee, and tea, these all increase urination. And then there's alcoholic beverages, which actually block the bladder's ability to reabsorb water, which causes more water to be lost. That's why if you have an alcoholic drink, such as a beer, shortly thereafter, most people usually have to go urinate and it feels like it goes right through you, right? But that's because the bladder normally would reabsorb the water that's sitting in the bladder waiting for you to go use the restroom. The whole time that you're holding it and waiting, your body's actually reabsorbing that water. But alcohol blocks that function. And so when you drink alcohol, all the fluids that you're taking in are just going to come back out. So here's some options for increasing fluid intake. And keep in mind, some people have dietary restrictions or texture limitations, but in general, these are some great options. Water, of course. Flavored water is good for folks who maybe just don't like to drink plain water. Fruit juice or fruit slushies, iced herbal tea that's not caffeinated, fruits and veggies, decaf coffee or tea, jello, soups and broths, pudding, ice cream, fruits, veggies, salads. These are all great ways to increase your fluid intake. And if a client insists on soda or sports drinks, help them opt for healthier choices like sugar and caffeine-free options. Some ways you can help prevent dehydration in the people you serve is to be aware of medications that may contribute to dehydration. You can contact their doctor or pharmacist for some advice regarding medications they may be on. Determine preferred fluids and keep them available at all times. Provide a personal water bottle when they're out in the community and have water bottles available at all times. Increase fluids when a person is sick and start at the first sign of illness. Talk to the doctor for suggestions for those who are on a fluid restriction. And educate clients with intellectual and developmental disabilities about the importance of drinking fluids. An important step to take is having a care plan for individuals who are at risk of dehydration. First, identify individuals who are at risk. Those with mobility problems or communication challenges, or who depend on caregivers to provide or assist them with drinking, or those who need to be reminded to drink fluids, and older adults. If a person has had episodes of dehydration in the past, try to find out the circumstances leading to that event. This information can be used to develop a protocol and prevent future dehydration events. Determine what strategies will be utilized for monitoring and prevention. This may include tracking intake and output. It could be a schedule of offering water or other drinks. Develop a policy, procedures, and protocols to maintain the person's health, wellness, and safety. And then write a dehydration prevention plan. Have clear instructions regarding fluid intake requirements. Acceptable minimal amount of fluid to drink each day, and criteria for monitoring the intake and output. List the signs and symptoms to watch for so that all of your staff know what they're watching for, okay? We've got to make sure we're educating all of the staff, all of the caregivers, everyone who's working with the clients should be taught how to recognize signs and symptoms of dehydration. And then have a plan that says what to do if dehydration is recognized and who to notify. And of course, don't forget to be a role model and drink fluids throughout your shift. So I ended a few minutes early, but I want to take this time to chat with anyone who may want to talk about dehydration or things that maybe you're doing with the clients that you work with to help prevent them from having dehydration. You can type in the chat or you can unmute. But does anyone have a dehydration prevention plan at your place of work?
Hey Jen, this is Shannon from Mid Valley Providers.
Shannon?
Hi, how are you?
Good, how are you?
Good. So, I think the hydration prevention plan is a great idea. I know here at Mid Valley, we typically, we're having snacks and beverages every couple of hours, basically during waking hours. It's kind of how our menu runs. But um, I was going to ask you, do you have sort of a template or something to base a plan off of? Because you're right, it gets incredibly hot here in Reading. Um, I know that when my folks are getting home from like day program, I immediately am like, hey, do you want some water? Do you need, let's get you some ice water. Let's sit down, have a snack. Let's cool off. Um, so what would a hydration plan look like other than kind of what we're already doing? And then what other ways could we help staff learn about dehydration? I'm thinking I might have them watch this at our next staff meeting here, this class.
You we have done this class before too, so there's already a recorded one on
Okay.
YouTube for this topic. For a prevention plan, you can do like a facility-wide prevention plan with just some general guidelines. But if you have some clients who, maybe they do rely entirely on care staff to help them with their fluid intake, then that's when you might put together an individualized plan that includes timing for how often they're going to be offering fluids, what types of fluids that the individual prefers. And of course, after working with someone for a while, you probably get an idea of what you can give them that they're going to just drink the whole thing and what they're
Yeah.
just going to kind of sip on and not be too interested in, right?
Right.
But also being able to, have the doctor or if you have a nurse consultant go over like medications and which ones might put them at a higher risk. One thing that's or one group of medications that we want to watch out for is anything that has anticholinergic properties, because that can lead to dehydration. It also can lead to cause like more higher risk for a heat stroke because of they actually cause an inability of the body to sweat properly. And so, things like that, you could do more of an individualized plan. It may include instructions for your staff to, monitor the color of their urine or, and who are we going to notify if the urine is getting dark or if we notice that they seem like maybe they're dehydrated and sort of have that protocol outlined.
I
But
worry
if
about
you,
this every summer. I worry about this, especially for my folks that have seizure disorders who are getting a little bit older.
Mhm.
Keeping not only them hydrated, but also staff from having their own potential medical issue if they're, so busy caring for others that they don't care for themselves. Hydration is something that I think about often with our folks.
Yeah, yeah, I worry a lot about our guys who are, completely dependent on
Yeah,
others the most because you're right. When we get busy, right? You're busy, you're taking care of people, you got all kinds of stuff going on. And so, going over and giving, Molly a sip off her cup might not be the top thing on your mind, right? So coming up with some strategies, maybe having like a every hour on the hour, everybody hydrates kind of a thing. We all drink some water. Or just some kind of a general plan like that could be even just a household plan, right? Everybody just follows along. And it
yeah,
wouldn't
I
have to
worry
be
about
that
this every
specific.
summer. So I love these ideas. And we do have a new nurse consultant, so I'm going to bounce some ideas off of her as well. But I appreciate all of this knowledge very much so. It's something that I think about and worry, especially because my folks are starting to age a bit and things affect them more, I feel like.
Yeah, it does. It does. And they don't recognize it as easily either because, they just don't have that same thirst response. But
Right.
also, I think when, and maybe I'm making an assumption, but as people age, I think that if they start to feel a little bit, maybe a little confusion or a little forgetful or a little off, they probably, are like, I'm just getting old. That's just being older, right? But it may not be just being older. They may actually be really getting dehydrated because they haven't been drinking enough. So,
Well,
um,
and staying hydrated helps us avoid like UTIs and keep it just keeps all your systems running better. So it's something that I push often with my staff and with clients. And some clients are, you need to watch them because they want to overdrink. I've had someone flush all their electrolytes years ago. He spent 8 days in the hospital because he flushed all of his electrolytes. It didn't happen on my watch, Jen. Don't look at me like that. It was a day program.
oh my
But
goodness.
yeah, he spent 8 days in the hospital, and three of
Mm,
those days he was in a chemically induced coma while they rehydrated him and balanced
wow.
his electrolytes. So I've seen what can happen when there's too much, and I've seen what can happen when there's not enough. That's
Yeah,
definitely
and either
something to
way, it's
take
not great.
seriously. No, no.
No.
Well, thank
And
you, Jen. Thanks for your time.
you're welcome. Thank you so much. I appreciate you asking questions and chatting with me about it. And
Absolutely.
if I find a good care plan, I'll send it to you too.
That'd be awesome.
Yeah,
All right.
no
Thanks,
problem.
Jen.
You're welcome. All right. Does anybody else have any comments or questions about dehydration? Okay, well, I think we'll just go ahead and end the class now then. It's a little early. Sorry, I went kind of fast, but Hopefully that gives you guys a few extra minutes in your day to do whatever it is that you want to do. And I will see you all next month. I hope you have a wonderful day. Katie, do you want me to stay on so that you can take attendance still, or did you
I
get it?
I have got everyone unless anyone hasn't entered their name and place of work into the chat yet. I think we're good.
Okay, cool.
All right. Thank you, everyone.
Have a great day, you guys.